Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about that how many minimum number of teeth has scientifically been proven that you can eat your food properly and your oral health functions can be maintained. Let's start. So today's interesting episode is all about how many teeth, minimum number of teeth should be present in the mouth of any patient regardless of age, gender or any sort of socio-economic background. See, I've gone through the literature, and usually whenever we go through the analytical or epidemiological studies, they say that minimum 20 teeth should be present. And now I've gotten into the research and I've seen, when I've seen the articles where they've done long-term studies, and it has been found out that 3-4 functions are served by the teeth. The presence of teeth, especially the masticatory efficiency, that means the chewing efficiency, the aesthetics, the phonetics as in how you pronounce your words, and the oral health, general oral and overall health of the patients and the quality of life. Now it has been found out through research in a lot of cultures, not just one area in Asia or Europe, across the globe. So it has been found out that the minimum number of teeth to be present in an individual regardless of age should be at least 20. So if it's 20 teeth, then it's a very good thing, and I would strongly recommend that there should be molar teeth in all the 4 quadrants of the mouth. That means if you divide the tooth into 4 quadrants, 1, 2, 3, 4, you should have at least your first molars. I've made an episode because for that as well. Secondly, I'll be very honest, when I went through the literature, most of the times people don't seek dental treatment when they want their chewing efficiency to be restored. They want dental treatment the moment their tooth falls out, which is present in the view or the field when you smile. So if your smile becomes deranged because of the fact that you have lost a tooth, that sense of social anxiety creeps in, and that dental anxiety comes in, and the patient wants to get the treatment done. This is what we found out in the research, that if people have lost their front teeth somehow, then they only seek treatment and not for the chewing efficiency. So I would strongly recommend at any point of time, even if the literature says it's 20 teeth, for the whole dentition, I would still say, apart from your wisdom teeth, if they're causing problems, all 32 teeth are important and try to preserve them. The only sense it makes, at least for a dentist like me, if the tooth has to go for extraction, is only for the reasons that there is nothing else we can do to save the teeth, be it RCT or any sort of surgery or anything of that sort. So please make sure that you try to preserve all your teeth through either dentures or complete dentures if all of your teeth have unfortunately fallen off, RPDs, removable partial dentures, fixed bridges and dental implants. I would still strongly recommend that you should go for dental implants, because that is the most researched and that is the most scientifically proven long-term stable goal when it comes to replacing lost teeth. So this was today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, and what common oral health problem is causing you pain or discomfort. And if you have any queries, questions, doubts, apprehensions or insights, please put them in the YouTube comment section. So that's it for today. Thank you.